Breastfeeding is a natural, life-saving act that can provide immense benefits to both mother and child. However, breastfeeding can be challenging for many mothers, especially if they are working or trying to maintain a normal lifestyle. One of the biggest challenges breastfeeding mothers face is finding time to pump breast milk regularly. While pumping isn't as time-consuming as breastfeeding, it does require some effort on the mother's part. In this blog post, we will explore how much breast milk a mother should be pumping and why it is important to do so. We will also provide tips on how to make pumping easier and more convenient for both mother and baby. So, how much breast milk should I be pumping? How much milk you should expect to pump will vary depending on factors such as your baby's age, time since last feeding or pumping, time of day, pump type, how much practice you've had with your pump, and whether you're relaxed or stressed. If you're primarily breastfeeding, on average, you can expect 1. More milk production in the morning hours. 2. Volumes gradually decrease during the day into the evening. Breast milk volumes are dependent on many variables, and each breast may produce different volumes. If you're exclusively pumping, on average, you should try to maintain full milk production of about 25 to 35 ounces, 750 to 1035 milliliters, per 24 hours. It may take some time to achieve this target. Do not worry about hitting this on day 1. Babies may take more milk from the bottle than when breastfeeding. The faster, steadier flow of the bottle causes some babies to take more than they need. A slow flow bottle may help prevent overfeeding. But, how long should I pump for? There is no definitive answer to this question as it depends on a number of factors, including the age and weight of your baby, how often you feed your baby, and how much milk your breast can produce. However, experts generally recommend pumping for anywhere from 12 to 24 hours per day. Here are some breastfeeding tips for new moms. As a new mother, you may be wondering how much breast milk you should be pumping. The American Academy of Pediatrics, AAP, recommends that mothers pump at least 6 times per day and to continue breastfeeding until their baby is at least 1 year old. 1. Here are some tips for pumping and breastfeeding. 1. When pumping, use a Medela pump in style or other manual pumps. Manual pumps are easier to use than electric pumps and provide more control over the amount of milk produced. 2. Pump while seated with your back supported. This position allows you to use more strength and reduce the likelihood of fatigue. 3. Place a cushion between your arm and side to minimize discomfort. 4. Avoid using ice packs or cold water when pumping. They can decrease milk production. 5. If you experience engorgement, massage your breasts before pumping to increase milk flow. What if my baby doesn't drink enough breast milk? If your baby is not drinking enough breast milk, there are a few things you can do to help increase her intake. First, keep track of how much breast milk she is drinking and make sure she is getting the recommended amount of breast milk for her age and weight. You can also pump breast milk and give it to your baby directly or store it in a bottle for when she needs it. If your baby is not drinking enough breast milk, you may need to try different breastfeeding techniques such as using a pacifier or supplementing with formula. When should you stop pumping breast milk? There is no set time or rule for when mothers should quit pumping. Some mothers decide to stop pumping around the time their child begins to eat solid foods. Others continue pumping past the baby's first birthday. Ultimately, it is up to each mother to decide when she feels her pumping has ended and she is no longer providing breast milk. Lastly, what are the benefits of breastfeeding? Breastfeeding is associated with a number of health benefits for both mother and child. These benefits include 1. Breast milk provides critical nutrients and antibodies that help prevent diseases in the baby. 2. It helps build muscle and bone mass in the baby. 3. Breast milk has anti-inflammatory properties, which can help reduce the risk of asthma and other respiratory problems in the baby. 4. Breast milk also contains growth hormones that help babies grow and develop normally. Was this video helpful? Like, share, and subscribe to our channel. Thank you.